If your kid is struggling to get rid of primitive reflexes and has asthma or has had maybe a mold toxicity, this is a really important test for you to do. Check their pulse ox. What you'll see in this kid is we checked his pulse ox and his oxygen saturation is in the high 88s and low 90s. And his primitive reflexes were present and he had a ton of muscle tightness and spasticity. All we simply did is we did EWOT therapy or oxygen therapy to get his oxygen levels up. When his oxygen levels were elevated at like 99, what happened is his primitive reflexes went away. And what that tells us is that his primitive reflexes aren't the problem, they're the symptom of his brain not having enough oxygen to be able to function appropriately to inhibit the reflexes. If you find this to be positive, a lot of time oxygen therapies will solve the problem and just getting that inflammation down. But if this is residually happening, you need to see a professional, a pulmonary specialist, to make sure we don't have asthma going on, or an ENT or a dentist, to make sure our airway is open up and functioning well. So just a clinical tip there. Hope you enjoy.